It's back to school time, which means it's back to the doctor time to get those immunizations. We've got an expert in the studio to tell you everything you need to know before you get those shots. The Health Source podcast starts right now.
You are listening to the Health Source podcast, presented by the Marshall Health Network. Now here's your host, Rick
Hello
Lord.
again. Welcome back inside the Health Source studios on the campus of Marshall University. This is the Marshall Health Source podcast presented by the Marshall Health Network. I am your host, Rick Lord, and today we are going to be talking about those school immunizations, and we felt that we needed to get whoever was most qualified to talk about this important topic. And so I couldn't even memorize all this, so I had to write it all down. This is Dr. Jacob Kilgore, by the way. Thank you for joining us, Jacob. Pediatric infectious disease specialist, medical director of the Hoops Family Children's Hospital at Cabell Huntington, and associate professor at the Joan C. Edwards Marshall School of Medicine. Have you found a trick to get like 36 hours in each day or something? How do you do all this stuff, man?
Oh, well, I think it's just a hearty breakfast. No, first and foremost, go herd, right?
Yeah.
And we are excited for back to school and appreciate the opportunity to come and meet with you all and just talk all things health and safety for the children of our community.
And specifically school immunizations, because it is something that's going to be prioritized here the next few weeks by a lot of parents and people that are watching this or listening to this right now. So before we get into all of that, we like to frame this podcast as kind of along for their journey on their path to wellness. So talk a little bit about your journey growing up in Wayne County and how you got to where you are right now.
Yeah, absolutely. So proud Wayne County native. I always say I'm not OW, I'm okay. That's outside Canova instead of out Wayne. But so my journey to wellness started early. I was born with something more visible, a facial hemangioma that started my care in Huntington. My parents were incredible advocates, brothers, sisters, and ended up sort of across the East Coast to find my own care and landed at Duke University of all places, and thankful for so many who had helped serve, and I still am a patient there. From that sort of birthed this passion to find a way to serve and to just that others had served me, and the medical field just felt like a natural progression to me.
Well, that's awesome. So you are an infectious disease specialist. You know a little bit about all of that stuff. So just talk a little bit about the importance of vaccines. A lot of people, especially in the more recent years, have kind of been wondering about, what vaccines are important, what might not be as important. But I mean, we have a long history of vaccines in this country that have prevented some bad diseases. Yeah. So just talk a little bit about the importance of vaccines and how do you differentiate them?
Yeah, I'll start by saying first and foremost, I think you mentioned something that's really critical. Is I think it's imperative that the idea of science is to ask why, and I think that at a time where maybe there is quite a bit of misinformation, it never hurts to revisit these questions and to make sure we're engaging families in the discussion. So I'm really glad that you brought that up. Our job as providers to not only know the science, but to be able to engage that science to be able to empower families. And like you said, immunizations have saved countless lives. It is probably the most impactful scientific advancement. It has been one of the most studied scientific advancements, and super excited to see where the future of vaccines/immunizations can go.
And you talk about that. The future is where we're all headed.
Yeah.
And with AI now and genomics and everything, it's been a fascinating world. What are some of the challenges that you're finding within this new era, this new world where AI is a part of it that can, obviously it's not a replacement for what you guys do, but people probably come in thinking that, I already Googled it or I AI'd it. But, I mean, you're getting, important what you said, there's a lot of misinformation out there as well. So no matter what you're searching for, if you're not searching for the right things, that's why it's always good to go to the specialist. So just talk a little bit about, how vaccines work and how far we have come from last century.
Yeah, so starting for your first question.
Yeah, that was a lot to unpack.
No, that's wonderful because I think there's an important piece there of leveraging AI to be able to engage and to empower with information. I think that's the age of AI, but how we use that information, how that information is subsequently leads you back to the original sources, and how we can take that and combine that with a healthy education within that topic is really that beautiful mix, right? I always hear the phrase, AI won't necessarily replace your job, but somebody who knows how to use AI might, right? So
exactly.
Something to keep in mind. But immunizations work essentially by mimicking in some capacity and or taking some piece of an infectious pathogen, not something that would be acutely infectious, but allowing the body to see it, to be able to respond to it, and to subsequently store that response ready to go for when you would see it again. We term those antibodies that are stored. And so the whole premise is priming your immune system ready to respond when it needs to. And each and every day we encounter tens of thousands of pathogens. And so it's this wonderful homeostasis of staying ready and then anticipating future exposures.
Well, no science is an exact science, right?
Perfect.
Science is all about like just figuring things out on the fly. But there is, am I not wrong here, a difference between a vaccine immunity and natural immunity from actually catching the disease and then recovering from it.
Yeah, I think they end in the same common pathway. I think the idea of vaccines, though, is you're helping to prevent that infection and or you're helping to limit the severity of the infection for those who go on to be infected. So when we talk about risk of natural disease and the immunity that could subsequently come from, I don't disagree that there can be natural disease immunity. The question is, is that sustainable, and is that something that not everybody in the community has the same immune system, and is it survivable? Is a frank question that you have to ask. And so the idea is to create that same environment, but within an immunization that's been safe, studied, and efficacious.
And how does all of that work into a phrase that became popular over the last 5 years, herd immunity? We're not talking about the thundering herd. Just in general terms, do they all work hand in hand with vaccines and natural immunity and coming to a place where the community has enough people that are immune to the disease to protect everyone else?
Yeah, I love what you said there. It's a sense of community, right? It's about looking out for others while you're optimizing one's own health. And so the idea is if there's some sort of population immunity or a population level antibody to a specific pathogen, that together we can help protect those who either can be immunized because they may have a condition that would prevent that, or those that are particularly most vulnerable, even if they have been immunized. And so keeping those levels up, that herd immunity, which very much goes with the Marshall University theme of Marshall for one, Marshall for all. So I've listened to Brad Smith when he talks. So,
there you go. Good man to listen to.
Yeah, the idea is that if you keep that at a specific level, that we can help to reduce and or eradicate diseases that can be devastating, as you referenced.
Now, not everything's perfect, so there are some side effects to some vaccines.
Sure.
What are some of the most common ones that you run into?
Yeah, so some of the most common adverse effects are going to be local and not sustained. So vaccines or immunizations are typically injectable. Some of them are oral, but most of them injectable into a muscle. So you can imagine there can be injection site redness, injection site pain. Occasionally there can be things such as fever, or a little bit more of a systemic response. Those are typically short-lived, anywhere between 1 to 3 days, and can be often symptomatically treated. I think a lot of the very, very exceedingly rare, as in 1 in a million, if not less, when I looked at most recent statistics to help prepare for this podcast.
There's a lot of zeros in there.
There's a lot of zeros. I'm not. We never speak in nevers or absolutes because I don't think, like you said, medicine is both an art and a science. But those are infinitesimally small, and that's why ongoing rigorous research studies, in addition to the studies that have already been done to demonstrate efficacy and safety, are continued on immunizations.
For someone watching or listening to this right now that might not be up to speed with the program in West Virginia, what are the immunizations right now that are required for school, and at what levels in the school district?
Yeah, so interestingly, we can go through each one of them, but we might have to extend the podcast duration. But
Cliff Notes version.
So the Cliff Notes version is, we follow the CDC recommended age appropriate guidelines, and a lot of the immunizations are combination vaccines, and so listing them makes it sound very overwhelming, but a lot of them are in combination. 3-in-1, 4-in-1. Interestingly, for West Virginia, we have one of the lowest vaccine rates prior to starting preschool and or kindergarten. But the beauty of immunizations is that it's that safety net that the immunization related recommendations for school. It's that safety net to catch everyone up, especially in a state where we really have a wide spectrum of access to healthcare and even at times, we talk about affordability, et cetera. It just sort of allows everyone to start on that same playing field, which is so important for public health, that public health piece, right?
Yeah.
Equity is key.
So you would, can you give someone maybe a website to go to or a link to if they want to check and make sure that they're up to date or that they know everything that they're getting into?
Absolutely. I very much entrust in the CDC vaccine website or the CDC immunization website. If you're looking specifically for children, you can go to CDC immunization schedule children. That's what you can type in any of your search engines. And it will take you, if you specifically were looking for adult, you can look at adult because also adults have various immunizations that are recommended depending on age and or condition associated with your immune system.
Now, there's the words pediatric and professor in this bio. So you deal with little kids, you deal with college kids, you're dealing with all sorts of people that come in. And at any age range, there might be some type of hesitancy. I mean, how do you advise them to work them and navigate them through that?
Yeah. So again, I think that the whole idea of healthcare is that it's yours, right? And so you wanna really individualize it. You want to engage families, especially those. 99.9% of folks are showing up to advocate for their child's health, and they're trying to do what's best for their child. I admire that. I don't have any children myself, but I have a ton of nieces and nephews, and they're a huge part of my world.
Takes a village.
Yeah, it takes a village, and so we have to remember that we're coming to the same common ground. That common ground is we want what's best for the children of our community, and then we can replace that children with adolescent and or young adult. And we see all those. As the age range changes, we're able to have that active discourse more readily with the patient themselves and sort of through a surrogate like a parent, although we always welcome them to be involved in the discussion. So our job as providers, again, you can know the science, you can entrust in the science and the rigorousness of it. But if we can't communicate that with the public, if we can't engage with the public, if we can't be willing to ask questions or be asked questions, then we really aren't completing our full duty to the public.
Now, I talked about the last 5 years, how the term herd immunity became part of our vernacular. Another thing that people were talking about was the new vaccine, the COVID vaccine, which is an mRNA vaccine.
Sure.
That's different than the types of vaccines that we were all accustomed to growing up for things like measles and mumps and diphtheria and polio. So just talk a little bit about, if you could, about the difference and how there is a difference, a fundamental difference between mRNA vaccine and the vaccines that we've all gotten to go to school.
Yeah, it's a great question. Without getting too much into the weeds, we have even before the mRNA vaccine, there are various ways in which we can either mimic or capture a piece of the various virus or bacteria that we're able to expose the body. And so that's why there's different vaccine or immunization recommendations for kid versus adult. It's what can the immune system most robustly respond to be able to store those antibodies while being safe and efficacious, right? And so you actually see different vaccine types for adults and how they're manufactured versus children. mRNA technology has been around for a really long time, been studied for quite some time, and fascinating advancements, not only within the immunization world, but targeting various cancer pathologies, et cetera. And so it essentially is going to leverage mRNA, which is going to be in a protein sort of manufacturing process, the same way that we would leverage taking a piece of a virus, which is essentially a protein, and allowing the body to see it and respond to it. So a lot of press, a lot of appropriate conversations around it. Again, scientific advancements should be rigorously studied. But the science is sound, and I think if we have another podcast, we could dive into mRNA vaccines.
Let's do it. Let's do it. We're always open for you.
Yeah.
So, do adults need boosters for their childhood vaccinations?
Yeah, they're interestingly, I'm not an adult provider anymore. I did my general residency in both pediatrics and internal medicine, but hop back on that CDC site even this morning because, again, there's yearly updates based on a governing body, the CDC with the ACIP. If you guys have heard the ACIP, no test at the end of this, I promise. But essentially those recommendations, common things are stay up to date on tetanus, annual influenza vaccine. There are certain vaccines for things like shingles into adulthood, certain types of pneumonias that you would want to consider. And then let's not forget also, too, in the adult space that those who go on to become pregnant, that there might be various vaccines that we think about both prior to and during pregnancy. Notably now, RSV being a common thing that we're recommending for vaccine. So a wealth and a sort of a spectrum of things to consider depending on where you're at in your life and where you're at as far as your own health.
So let me ask you this. This might actually be outside your wheelhouse, but I doubt it because you're so darn smart. You probably know a little bit about everything.
I haven't pulled. I think,
So how do public health agencies prioritize what immunizations to put on the program?
Yeah, that's actually an excellent question. So this is one of my loves of infectious disease is epidemiology, which is the study of disease in populations, right? And so the idea is what are we seeing? What are we seeing locally? What are we seeing nationally? What are we seeing as far as trends? What is disease severity? And do we think as far as some sort of intervention, such as an immunization that could provide some immunity, can it be lasting and can it be overly efficacious to either prevent or limit the severity of disease? So when you intertwine all of those things as well as emerging pathogens, right? SARS-CoV-2, an emerging pathogen that very much looked like some other things that have been studied for many years, that's where we're going to continue to target our efforts. Ideally, we have people, and this is not hard to do, way smarter than me, studying these trends, trying to stay ahead of the curve. Man, that's when infectious disease gets even more fun.
Oh, infectious disease and fun in the same sentence. How about that?
I know. I'm not great at dinner conversations.
I'm sure that's not true. So, okay, so moving on to something that I find fascinating. You brought up a great point about every parent that brings their child in, they want what's best for that kid, right?
Absolutely.
So they think that they're doing the right thing for that specific child, and it's you can have the debate back and forth about whether it is or isn't, but is there a way to balance that individual choice with community health when maybe sometimes there might be a contradiction there?
Yeah, that's
I got in the weeds a little bit on that.
No, you didn't at all. I think it's an important topic, and I think these are the questions we have to ask the hard questions. I'm not sure I have the perfect solution other than let's engage in conversation, right? What is it at the core of your individual decision making that is limiting you in some capacity or keeping you from wanting to follow what the evidence-based science would say? In that individual decision discussion, have we thought about how it could affect your neighbor? Have we thought about how it could affect those who are most vulnerable? And in those decisions, let's ultimately think that individual decision is also not without consequence, right? So you're free to make decision for self, but what does that mean as far as the implications or consequences? Has sort of a negative connotation, but it's not
cause
without
and effect.
cause and effect. And so how do we think about those things critically, and how do we discuss that with professionals who are truly sort of the most versed in that space? And then how do we come to a conclusion together? Capture that in the 10-minute visit that you have, and then we're good to go.
Yeah, challenging, right? So, and speaking of challenging, what would you say is the most challenging aspect of all of your jobs, really, and what keeps you motivated to be doing as much as you're doing right now?
Yeah. The least challenging aspect is remembering that we're helping grow a healthy generation of the future. The most challenging aspect is to get my dogs to go out in the morning to do what they need to do before I come into work. No, I think the most challenging aspect right now is allowing people space to feel like that they can express themselves, and reminding each other that we're in that same. We both want the same thing. To limit polarization.
Good luck.
I know, right? I think it takes just a listening ear, and I think it takes sometimes multiple opportunities to be able to have that discourse. I think sometimes we think we're going to accomplish things immediately, and sometimes it takes time, right? It takes time and compromise.
I love the dog answer. See
Thank
that?
you.
Doctors, they're just like us.
We are. Yeah, we are.
So where do you see this headed in the next 5-10 years? Put on grab your crystal ball and let me know in the realm of immunizations and where the country and where the world is headed. Do you foresee any big advancements or anything that will be a game changer?
Yeah, I'll say first and foremost, I'm so proud of West Virginia because we've led in the space of immunizations, school-related immunizations for many years, and many states are looking to do what we do. We're a group amongst 5 that have some of the most rigorous school-related immunizations, and like I said, at times that's the only health measure that some folks have to help limit disease. Ideally, into the future, again, we're looking. It's sort of a dynamic process, and multiple things are happening concurrently. We're anticipating future pathogens. We're helping to optimize what we currently can do and can offer in the immunization space, and then it's also just about. I really do think the most important thing is just active discourse about what it means to try to use immunizations most effectively, and understand that we're all in it for the kids.
We are all in it. They're the future for sure. Was that a Whitney Houston song? I think.
You don't want me to sing that. Not on this segment.
So let me ask you this: is there ever a situation where a vaccine, and I know that everyone has their own health, their own, there's no blanket statement or answer for anything, but is there ever a reason why a vaccine might not be safe or just might not be right for a child?
Yeah, absolutely. Let's use an example. You asked a really articulate question about how vaccines work. And so some of the vaccines that would be termed, quote, live and viral would mean that we take a very attenuated snapshot or sort of piece of the virus that is live in some capacity, obviously preventing it from causing severe active disease, but those can sometimes provide the most robust immune response, right? You're essentially seeing it almost real time. You can imagine that a child that would have an immunocompromising condition, for an example, you could have a child with a newly diagnosed malignancy or cancer on active chemotherapy. It could be a child on high-dose steroids for a longer period of time that could put them at risk for response, because steroids can kind of attenuate your response to vaccine. And so you wouldn't necessarily in those scenarios want to expose them to that vaccine type. And so it's a really strategic intervention of, as we see these things coming, if we have the foresight, what can we do to sort of advance that vaccine schedule forward to help store some of those antibodies and not make them particularly vulnerable to something that would be, that they wouldn't be able to, their immune system wouldn't be able to keep that, quote, live vaccine in check, like myself, who thankfully have a pretty well functioning immune system.
Well, good for you.
I know, I'm lucky. No, I am. Listen, yes, we are lucky. We are blessed.
So, we're here in the middle of August. Kids will be going back to school soon, and I know that we've probably hit on this a little bit here and there throughout the last half hour, but wrap it up in a bow and we'll get you out of here on this. Give us your best 30 seconds or 45 seconds of why it's so important to get those school immunizations.
Yeah, that's a great question. School immunization in general, one of the most efficacious invention is not the right term, but intervention in all of the history of medicine. Immunizations can help limit the spread of disease, and often prevent very serious illness. Immunizations allow us to function in a public space where we can feel as safe as possible. Immunizations allow us to be in school to learn and not miss days. Immunizations allow us to have teachers and other school providers readily available and healthy. They also help protect those most vulnerable, those kiddos, those staff that want to come and participate and be part of a public service who otherwise wouldn't have that chance. So it is very much about herd immunity. It's also about protection of self. And so that would be how I'd package it. And I hope you all have the best school year. It's what a fun year, and excited to see. I'm getting old. I'm not getting younger. So
come on now.
We need the next generation of doctors.
See all these grants? Listen, you got herd in again at the end there. I noticed that.
I did.
With the Marshall logo behind you, you're always representing Wayne County, Huntington, West Virginia as a whole. Dr. Jacob Kilgore, thank you so much for your time today. We really appreciate it.
Thank you.
We thank you for joining us again. Of course, we are here to help you on your path to wellness, so we can't do this without you. And if you're listening on Spotify, be sure to subscribe. Until next time, I'm Rick Lord. Take care.
That was the Health Source Podcast, presented by the Marshall Health Network.